Ladies and gentlemen, would you welcome Dawn O'Neill?
Thank you very much for that kind introduction. Collaboration has been called an unnatural act by non-consenting adults. It's great to be with you this afternoon. I'm going to take a bit of a romp through collective impact. Unfortunately, I don't have any funny clips. It's a really hard act to follow at this time of the afternoon. We've heard an inspiring presentation by Michael McAfee, who I think gave a great example and great focus on the work that we're all here to do, and talked about the discipline of the work. And so I'm going to sort of romp through very quickly, in a short period of time, the things that I've been able to learn and gather some understanding of around how to do this work. It is disciplined work. As I've just said a moment ago in the little workshop that we did, I believe we need a university to house all of the knowledge that we need to do this work. And maybe universities need to not just have business schools, but have social sector schools or third sector schools or something, because it is such big work. I had the privilege of doing a study tour with a colleague of mine to the US to meet with and talk to many people that were doing collective impact work. I've learned a lot and have spent the last 2 to 3 years really deep diving to try to understand this. I don't feel like by any stretch of the imagination I'm an expert, but I'm on this learning journey, and it's fascinating and challenging, and I hope incredibly rewarding when we see the needle move on the areas that we're really passionate about seeing change around. And for you, I know it's about children. If you want to go fast, go alone. If you want to go far, go together. We know how to do big work, and big work requires that we all work together. That's why we need to learn these skills of collaboration. Nature can teach us many things, apart from being able to laugh, as we just saw a moment ago with that wonderful clip. Migrating birds. There have been scientists that have studied these to find out how do they actually get from one side of the planet to the other. And they've discovered that there's 3 simple rules. One is that you fly at the same speed as your neighbour. The second is that you maintain the same distance between you and your neighbour. So they're both obviously connected. So don't go too fast, don't go too slow, don't get left behind, but stay close to your neighbour so you understand them. You know what's going on for them. And I think that's where the data comes in, and we've heard quite a bit about listening to your community, listening to people with a lived experience. Incredibly important. We need to stay close to each other, not stay in our cubicle at the office. And the third rule is to lean towards the middle. And that's how birds manage to get from one side of the planet to the other. They also take turns to lead. It's not the same leader out the front. So if you don't remember anything else that I say this afternoon, hopefully you'll remember that simple set of rules. Stay close to one another, so learn about each other, learn about what's going on in your community, stay close on the ground to and stay close to people on the ground so you know what's going on. Lean towards the middle, be focused on where you're trying to go to, the work, as Michael talked about. What is it that we're trying to change? What difference are we trying to make? And take turns to lead. Can't be the same person out the front all the time. It's too tiring. Too big a work takes too long. There's no question that our world is very complex and becoming more complex. And there's no question that in complexity, we need a different skill set. And that's one of the things I'm just going to sort of take us through a little bit of thinking about complexity and systems thinking around complexity. The good thing about us as human beings is that as the world has become more complex, and as we've evolved as human beings on the planet, we've continued to adapt to our environment. We're very, very good at that. And so I think we're at a stepping point, a change, a really step change time in the way that we work, and particularly around social sector change. The social problems that we're facing are quite different. Obesity, they're all depression, mental illness, big scale issues that affect wide, very large numbers of the population, require us to work in a very different way, not in a transactional way, but in a transformational way. So it's a step change, and it requires us to develop new skills and new strategies, and that's part of the discipline of this work. And we're good at adapting to that, and we're in a stage of adapting even more. You would all be aware that there have been many, many reports written around the problems that we're facing. As I said, many of them are the unintended consequences of the modernity, of our modern age, the way that we have wonderfully designed to live for ourselves, and the consequences of that, like obesity, for example, are things that we didn't really anticipate were going to happen. And that's the nature of systems. As they change, there's always unintended consequences. So how do we work in a way that's responsive to those changes as they emerge? Been many reports written about what's wrong, what's not working, where we're not seeing shifts in data around homelessness and other problems. And almost all of them say it's because the system is part of the problem and we need to collaborate better. So how do we do that? We already spend a lot of money. You don't need to look at all the details around that, but we spend about somewhere around $225 billion a year in Australia today around social sector work, one way or another. That's a lot of money. It's a big part of our budget. How do we better align and better target those funds towards the work that we really want to do, the work, the needle-changing effort? Because at the moment, unfortunately, we're just not seeing the changes that we thought we would have 15, 20 years down the track. And that's what this conversation is about. So I'm going to romp through quite a lot of data. All of these slides will be available to you afterwards, so don't feel like you have to try and jot down everything. There's a lot of content on some of them. Don't worry about trying to get it all, you'll be able to read it afterwards, but I've just left it on there so that you have access to that information. I'm just going to turn this thing around a bit. Complex systems. I've been trying to get my head around complexity. For those of you that want to read more, there's a wonderful book called The Systems Primer by Donella Edwards, and she talks about systems thinking. We all instinctively understand complexity and systems because our bodies are one. We're adapting all the time to our environment. The environment that we live and work in is a system. But we often don't understand necessarily all of the feedback loops and the levers that we can pull to shift systems. And that's part of what I think we need to get good at doing as part of collective impact work. Collective impact is systems work to a large degree. It's not just about programs and projects. It is systems work. So complex systems are not predictable in detail. They constantly change, they evolve over time. They're constantly impacted by all different things, and so that's why they're complex. Sometimes they're called, or complex problems are also sometimes called wicked problems. Wicked problems also is a term that's been devised by designers and mean things like that often there's contradictory opinions about the cause and the effect, or wicked problems might be that researchers or experts disagree on what the problem is. So wicked problems, complex problems, they're constantly changing. It's very difficult to pin them down. And that's often the environment that we work in, particularly when we're talking about vulnerable children, disadvantage, and communities that might be struggling to provide the opportunities for the families and the people that live in them. So I'm just going to take you through a very brief framework that has helped me understand how maybe we got into a little bit of the muddle that we got into, and I hope this is useful to you. It's called the Cynefin framework. Cynefin is a Welsh word. It means the habitat and the place that we live. Dave Snowden is the man who developed this, and there's a wonderful YouTube. You can go online and have a look at that and listen to him describe it, possibly clearer than I will, but I will do my best. In the middle of this framework is this little space called disorder, and that's the place that we often sit in. It's where I often sit in, disorder, not really sure where I'm going. So this is a sense-making framework. It's not a categorisation framework. It's to help us make sense of the world that we inhabit and how we make decisions around this world. What sort of decisions that we might, or solutions we might apply to certain problems, and what sort of skill sets we need when we're applying those solutions. So the first kind of problem that we might often confront is a simple problem. We're really good at working in this space. For a simple problem, cause and effect is close together, so we would sense and we would categorise and we would respond. And the skill set that we need there is best practice. We know how to do best practice. For complicated problems, sorry, I don't have it up on the screen in front of me. Oh, I know what I need to do. I need to put my glasses on. That'll help. Perfect. For complicated problems, this is where cause and effect is a little further apart. We might need to do some analysis, so we need to do some technical data collection, whatever, technical work. You might need to get some consultants in, and that's where good practice works. So we're really good at both those sides of the framework. But when we're talking about complexity, as I just talked about a minute ago, that's where cause and effect is a long way apart, and there's lots of disagreement about what the problem is and how we need to respond to it. And in complexity, this is where we apply a different kind of practice, and it's called emergent practice. And this is this new skill set that we need to develop. For chaotic problems, this is where we just need to act. We know how to do this. When fire, there's a flood, there's a problem, there's a crisis, so we act, and that's novel practice. So you'll see there's that little dotted line down the bottom. That's called the cliff. And you'll remember during the GFC we talked about the fiscal cliff, and everyone was terrified that we fell off the fiscal cliff. We didn't know what was going to happen. So Dave Snowden, when he talks about this work, he talks about the fact that if we try to apply simple solutions into complex problems, we quickly fall off the cliff into chaos. And I think that's partly how we've ended up in a little bit of the muddle that we're in. That we've often thought that the areas that we're working in were not very complex, and we didn't need to apply an enormous level of skill, an enormous level of resourcing. We didn't need to apply our very best minds to it necessarily, or we didn't need to harness as many resources and assets towards solving them. We thought that if we could just come up with that killer program, that latest bit of research, and apply that well enough in a small space and then scale it big enough that we were going to solve some of the complex problems that we were faced with. But what we found is that that's actually not the case. So you can see there the skill set needed in simple problems is coordination. In complicated problems, it's cooperation, but in complex problems, it's collaboration. And this is where the nub of the challenge is in the collaborative work. So as I said, that right-hand side, education and training, we know how to do that area well. It's this other area of complexity, which is the new area where we have to develop the skill set. This is just a little small map. You don't need to look at the detail of a child trying to get speech therapy. Murdoch Children's Hospital in Victoria developed this, which gives a bit of a taste of what our service system looks like for a person trying to get help. And again, I think this illustrates how we've tried to apply simple solutions and often ended up in a bit of a muddle. So the red child, the blue is the health sector, the green is education, and the orange is welfare. And these are all the choices, and this is just in one small area of Melbourne. No wonder people find it hard to get access to help. This is another example of the mapping work that they did. And again, this skill of being able to map systems and do systems design work and systems mapping is a really important skill set and is a really useful tool. The communities that have done this, it's provided an aha moment when they've been able to map effectively what's going on in their community. It's garnered energy and motivation from the community to come together to say we've got to do something about this because this is not working for people. This diagram shows a number of families. The colours represent different families and the different agencies that they're engaging with. And you can see most families are working with a number of agencies, and the lines between the dots are the agencies communicating with each other, and you can see there aren't many lines between the agencies. So the agencies don't necessarily know what's going on for the families. The families are having to tell their story over and over again, and you would all know this story. So how do we unpack this and unravel this kind of place that we found ourselves in? And this is where the idea of collective impact has emerged. Collective impact, as Michael talked about this morning, emerged out of some work that occurred in the US. Mark Kramer and John Kania, who work in a big consultancy called FSG, that was set up by Michael Porter and Mark Kramer. They were all good buddies with MIT people like Peter Senge, who understand systems, and they said, how can we improve the social impact? How can we increase our impact? How can we get better results for all of the effort and all of the energy that's going on in communities? How can we better harness all of that isolated effort? And they looked at how to catalyse philanthropy more effectively. They looked at what the corporate sector, what the private sector can do, and they developed a whole lot of thinking around shared value. And there's a whole discipline around that. And then they developed this understanding around collective impact. And they did that by talking to about 150 groups that have been collaborating in communities, and they said, what's worked? What worked in your community when you were collaborating together and trying to bring all of that isolated effort together? And the 5 things that people said really made a difference were those 5 elements that Michael talked about. So they talk about collective impact as the commitment of a group of important actors from different sectors. So it's not just the community sector working on its own, it's government, it's business, it's the community, and it's people with a lived experience, citizens, all working together towards a common agenda for solving a specific social problem. So I'm going to say that again. It's a commitment of a group of important actors from different sectors to a common agenda for solving a specific social problem. It's often, but not always, but very often in a place. It's in a geography. So the boundaries are around a geography, and it's around a population. As Michael talked about this morning, it's population-based work. It's not program-based work. So the 5 elements, as Michael talked about, he set the scene beautifully this morning: common agenda, shared measurement, mutually reinforcing activities, continuous improvement, and a backbone organisation. So I'm just going to do a bit of a deep dive into some of the tools and techniques and things that others are using that have been helpful in these 5 elements. It's been applied in many, many different sectors or different problems, types of problems: homelessness, healthcare, education, poverty reduction, community development. So it's not topic specific. So it's a framework to guide the work regardless of the kind of area that you're focused on. It's about getting started somewhere. It is emerging in a big way in Australia. I'm thrilled to say there are Australian initiatives, and there are many initiatives or work that people have been doing in communities, like Communities for Children, which of course have utilised all of those elements and done them with great effect, but may not have used the terminology collective impact. And that's fine, you don't have to. It's just a guide to help organisations and communities wanting to do good work, what's best practice, what's worked for others. So there's a new emerging initiative in Shepparton, Queensland, Logan, that area are developing a fantastic initiative up there. And everyone's doing it slightly differently, but applying and trying to rigorously apply, having a common agenda, getting all of those cross-sector groups together and using data more effectively and aligning effort. The Blue Mountains, Children's Ground in Alice Springs, Go Goldfields, which is one relatively close here. I'm going to talk about that in a bit more detail. The Blue Sky Childhood Initiative in Melton that those diagrams were developed for, and the 90 Homes for 90 Lives. So there are a number of case studies that you can read. Not all that much has been documented. It's one of the things we need to do better, I think, in Australia, is documenting short, brief case studies where we can learn the lessons of what's worked. I don't know if you're aware, but on average it takes 17 years for research to be translated into practice in Australia. 17 years. We have got to get faster at learning. So we've developmental evaluation. So, a common agenda. Francis Ford Coppola said, if you want to make a good movie, you've got to the main thing is to get everybody making the same movie. One of the things about a common agenda is it must be common to all, and that takes time. It's not about me having an agenda and convincing all of you on my agenda. It's about everybody together developing a common agenda and coming to a common place of understanding. And where you might start might not necessarily be where you end up, I should say. The Strive initiative that I'll talk about in a moment, I'll talk about right now. They started off, so this was the first Cradle to Career initiative that started in Cincinnati, Ohio. When they started this conversation, it was about the business community wanting young people ready to work in their businesses. And they were frustrated because young people, they couldn't employ enough in their community because they didn't have the right skill sets. And when they started to talk to the community said, well, you need to start in early childhood. And that's how they developed this Cradle to Career vision for education. It also emerged because they'd been investing, or philanthropists had been investing millions of dollars in that community over about a 15, 20-year period, and they really hadn't seen a shift on early childhood, readiness for school, outcomes at all levels. So the GFC hit, there was going to be less resources, they decided to do an evaluation, and they said, what's the outcomes after 15 years of investing millions of dollars in this community? And sadly, the results weren't great. Nothing much had really changed. Poverty levels were still the same. Educational outcomes hadn't really moved. So they said, what do we need to do differently? And that's where this developing a common agenda and the common measures began for them. And they developed this vision of a cradle to career. They developed 5 outcomes that were all about the person and 52 indicators, as Michael said this morning, and they began to, the whole community, all of the service sector and the community started measuring the same things, and they're still doing that work 8 years on. As I said before, this is cross-sectoral work, so when you start on your common agenda, it's really important to invite everybody to be around the table. One of the great tools, as I mentioned in the little workshop we had a moment ago, that some of the people in Canada have used, they've had these round tables where they've had 40 people around the table, 10 from government, 10 from business, 10 from the social sector, and 10 people with lived experience. And that's been the group that they've started to develop the common agenda with. Very different conversation when you've got 10 people with a lived experience of poverty or whatever around the table. It's not us doing something to them, it's how do we work together to get the outcomes you want for your community, for your families, for you. So a very different experience, not a token gesture. And having business around the table. It's crucial to have all parts of the system around the table. All of the problems that we're struggling with require all sectors, not just the funders, not just the service providers, but the people with a lived experience and the business community. So it's a different way of working. Very important to just draw out that even though in the collective impact framework it doesn't specifically talk about the community being at the centre, but it is crucial. We know that it's vital that the community be engaged, the citizens be on board, and people with a lived experience be at the centre and be the accountability measure. So very important to, in the discovery process around getting your baseline data, that part of that is the stories from people. Storytelling is crucial. It's part of what changes the behaviour of the system, is the storytelling that occurs. Magnolia Place is one of the examples that's often used and it's been studied and reported on quite a lot. I'm sure many of you have heard about Magnolia Place, where they are changing the health and educational outcomes for 35,000 children in a very high density part of LA, very poor and diverse part of LA. And they've been going for about 8 years as well. Haven't seen significant shifts, but they're starting to see some shifts. And some of the very interesting things that they've learned along the way and that they've done along the way that I think are useful and may be useful to you in your communities. One of the things that everyone struggles with is that people come in and out of communities all the time. People come in and out of organisations. So, it's a changing landscape. So they've developed this methodology where every 2 months they do a briefing for the community. So for people who have just come into their job in whatever service, XYZ service, or people who've just moved into the community, there's an opportunity for people to get together to learn about the work that's happening in the community and how they've arrived at the place that they're at. So every 2 months, it's a formalised process. They bring all the new people into the community. So the families, the service providers, government staff, businesses, anyone can come along and learn about this work that's happening. And it's an ongoing briefing process. Very clever. And I think it's made a really big difference in, that sort of musical chairs that we often experience when doing this work. It's really hard to keep people up to speed with how did we get to here. Some of the other things that they've learned is that they started off with an integration of a service. So they started off with a single building and putting co-locating services in one place. And although they said that was very useful and that was a great exercise, it's also been very expensive and labour intensive. And they said if they had their time again, they would have started working with the community and the systems change and the behaviour change in the community rather than co-locating services, because I think that's often one of the things that we think that's really going to change things in my community if we can just co-locate services, but sometimes that's not the whole work. So I'd encourage you to check them out if you're curious about that. As I said, we've got a great example closer to home, the Go Goldfields work. They've got an investment. It's co-located in a local council. They're the backbone for the work, which is a different model again, and they've begun to see already changes after just 3 years. So they got an investment of $2.5 million to get them started. It's a whole of community effort. Again, a Cradle to Career initiative, looking at a whole range of indicators and goals, and they've just done their first evaluation and these are the results. So that's an example you can look at closer to home if you want to look at a good case study. Sharon Fraser is the great champion of that work there, and she's an inspiring person to speak to and to learn from. Shared measurement, I think we heard from Michael this morning how important, how critical this is. And this is the Promised Neighbourhoods little diagram where, as Michael said, they did the work up front around building the infrastructure around how to collect the data and have not taken the many flowers bloom approach. I don't know how many times in Australia we roll out a set of programs across the country and we let everybody collect different data on different data systems and no one can share their data and we end up not learning enough. I think this is brilliant, this approach that they've taken, and I think we can take a leaf out of their book. And they've used that results-based accountability up front to help develop the outcome measures. That's the framework. And they've developed data dashboards at the other end so that you can visualise the results of the work and share the information. Very clever. This is the results-based accountability to measure 2 key questions. How much did we do and how well did we do it? It's just to remind you to check that out if you're not already familiar with that work. Mark Friedman, he's got a great website. There's lots of free resources on there. I encourage you to have a look at that and learn about that. This is one of the kind of dashboards, the kind of thing where you can visualise the data and the whole community can see how we're doing against these measures. So this is the Strive community. The green arrow means we're doing well, the red arrow means we're not doing well, and that's where you can get around the table and say, why didn't that go green this year? What do we need to do to change things? So focusing in on the indicators, what's working, what's not working, having that developmental evaluation approach, not waiting for 3 years to the evaluation's finished, but looking at it quarterly, monthly, annually, what's going on, staying close to the work so that we can see what's going on. This is drilling down into one of those measures, so early childhood measurement. You can see it's not, a straight line going up. Sometimes it's just incremental change. This is school readiness for that community. One of the communities, you can see they started off at 44%, they're now at 56%, and their aim is to get to 85% for school readiness. This is a very poor part of Ohio, Cincinnati, Ohio, so I think many of the communities here would be starting at a much higher level, but you can see it's not necessarily fast work. Often there's many competing forces, unemployment, other economic disadvantage, so it's incremental work. One of the great stories that I heard around what does this actually look like on the ground, this work. So there was this particular school, how this area of work panned out was they found that there were a huge number of the kids coming along to school that weren't school ready. And they knew that school readiness meant that kids needed to be able to identify letters, have alliteration skills and some numeracy skills, and they needed to be able to count to 10 or something. whatever the school readiness measures were. And so they knew that something like 40 to 60% of the kids were actually not school ready when they got to kindergarten. But they didn't know why and what was going on. So they decided to stand at the school gates and talk to the parents. And they asked the parents, so where did the kids go to school? Where did the kids go before they came to kindergarten? Were they at home? Were they in daycare? Were they in preschool? Where were they? And they found out that a huge number of those kids were actually in daycare because the parents were working. And so they decided to just bring the daycare teachers into the school. And the daycare teachers, first of all, said, "This is fantastic, thank you for inviting us. We'd never really seen ourselves as part of the education system. We didn't know we had an important role to play, so it's great to be here." And then the schools, and they put down the results of their little research project, asking their parents what the kids had done before they got there. And they said, "Oh, we didn't know we had to teach alliteration and letter identification and the numeracy skills." And so they put in place, the schools all banded together, pooled their funds, taught the daycare teachers how to teach those skills, and what do you know, the results started to go up. So it just took that asking the question, understanding the issue, thinking outside the square about who's involved in that system, who's a part of that system, and working together, pooling their assets to be able to see the results that they wanted. I've mentioned developmental evaluation. You obviously can't read all of that detail, but I've put that up there because you can have a look at it afterwards. It is an approach to evaluation that is different to the traditional way of evaluation. There's a website about it, and it means measuring as we go, prototyping what we do, trialling it in a small space. If that works well, then taking it to the next level. So it's quite different to the types of evaluation work that we've done in the past. This work requires us to, it's emergent practice. So it requires us to measure as we go and learn as we go. We have to trial it in a small space, see what works, and then roll it out if it works, but not do it if it doesn't work. As I said, the study tours, the key lessons for me was around data was that don't let perfect be the enemy of good. Sometimes we can get awfully wrapped up in trying to get the data perfect. Sometimes we just need to go with what we need to go with. So that example I just told you of standing at the school and steps and talking to the parents. And often we make it a bit too complicated. One of the other great stories is the 90 Homes for 90 Lives project, which was a cross-sectoral project that happened in Woolloomooloo in Sydney. It was during the Rudd time when there was some funds to end homelessness. They decided they wanted to do something about homelessness in this part of Sydney, that had King's Cross area where they'd had rough sleepers for a long, long time. They had business there, they had the banks there, they had United Way, they had a whole range of service providers, and they said, let's see if we can end homelessness in this area. So the business people asked that very obvious question, but an important one: how many rough sleepers are there? How many homeless people are there? And no one knew the answer. So first of all, they did a bit of analysis, so how many service providers are there? So they found out there were 52 service providers, which included all of the police and the emergency services and all the people that were providing services to the homeless. But then they didn't have the answer. They said, well, it's just too hard because we don't count numbers, we count service interactions. And we don't actually know because, we do this number of people, we get this number of people through our doors, etc., etc. So what they did was the bank asked their staff to volunteer to stand to go onto the streets between 2 a.m. and 4 a.m. in the morning and count how many homeless people there were. And they discovered there were 90. There were 90 rough sleepers. So now, I think about 4 years later, they've now provided supported accommodation, wraparound services and homes, sustainable living, for 87 of those 90 people. And I think that knowing what the population was a real key to them, for them to be able to gather together and pool their assets and their resources to be able to solve that problem. Now, of course, more homeless people have moved into the area. It's like one of these complex systems that constantly changes, but I just think it's a great example of sometimes we get too complicated about the data, but let's just go out in the street and count and get a rough idea of what the size of the problem is. Mutually reinforcing activities. So this is the stuff we do together. How do we align our effort? How do we bring all of that isolated effort where we're in our little projects and programs together? And this is the disciplined work. I just want to show you this little tool. Again, you can go and look at this in more detail. I don't have time to go into it in great detail, but this is a framework that's been developed by Twyfords. There's a great little ebook you can download off their website called The Power of Co, and they unpack a lot of the co words like cooperation and collaboration and coordination, and what do they mean. The great thing about this diagram, you can see that this is a loopy process, and the first three elements of these loops, so the commit to collaboration and co-defining the dilemma and co-designing the process. So those three big steps, when we're starting at the problem, when we're trying to get to the solution, all of those things need to happen before we actually start collaborating together. So before we actually co-design a solution, we first of all have to commit to collaboration, and often we'll go around in those circles several times and come back to the commitment, because it often requires some of those difficult conversations that Michael was talking about before. It requires increased capacity over time and building trust. When you're talking about multiple organisations working together across a community, that requires a lot of trust building. It means that we have to have appreciative mindsets. It's a skill set around appreciating the wisdom in the room, the knowledge and the skill set amongst all of the sectors and the players around the table. No one's an expert in this work. We all come with an appreciative mindset of understanding that everyone in the room has some knowledge to contribute. How do we better understand this problem together and work together on the journey of solving it together? And we build capacity and we build skill as we go along. So another tool that might be useful to you. Again, thinking about the structure, co-designing the process, how do we work together? This is cross-sectoral work with many partners. There has to be a way of framing the work and organising it. So there's the backbone organisation. There might be a steering group like that round table I talked about. There'll be working parties, and there's a constant communication to align all of that effort. It's big work. This is another model that you can look at and explore, the constellation model. Again, where there's lots of working groups working on different parts of the system and the problem, and then coordinating that effort and seeing if it's making a difference. So these are just things that might be useful to you as you get started in this work. There's lots of lines in there. I'm not going to go into that in great detail. Also, of course, you have to have a plan. As you mutually align your efforts and work together to align your efforts, you need to start off with a plan. One of the key things, of course, is having the common agenda, which we've talked about. Developing principles around the way you work. Some of those things that Michael talked about, being able to provide that container, that safe space where you can have some of those difficult conversations. One of the other examples that I haven't put up here is of a great initiative in New York State where they've worked on juvenile justice issues and reduced incarceration by 45% in a relatively short period of time in New York State, in a very difficult environment where there were whole towns whose livelihood depended on those prisons that were there. So the whole town was employed to work in the prisons or some of the support services. So actually changing that system meant some really, really tough conversations and some really difficult decisions, getting everybody to buy into, actually, yes, we don't think it's a good idea to be imprisoning our young people, so we need to change our system. So what does that mean? How do we create new jobs in this community? Difficult conversations, but important ones. So in your planning, think about short-term actions, medium-term actions, long-term. You might need to think about 30-day, 60-day, 90-day planning, short-term plans as you test and try things. So obviously there's planning work that needs to be done. The continuous improvement sciences, again, I'm not going to go through these in great detail, but there's all these disciplines around how we work together. Six Sigma, Michael mentioned this morning, process improvement. So all of those things need to be brought into play. The things we've known about for 80 years in the business world about act, plan, do and check, and putting policies in place to hold those things in place. It's a constant learning process. Continuous communication, obviously with all of those partners. People commit because they're involved. We're pretty good at this. I think we know that you've got to get people you've got to consult with people, you've got to inform them. There's great frameworks like the IAP2, the International Association of public participation framework, which is a really good guide. But overall, it requires us to go slow to go fast. The backbone, the work that the backbone organisation or the backbone functions, it's not necessarily a single organisation that does this work. Often it's a set of functions that more than one organisation can do. But one of the key things about the backbone is they need to be a servant to the work. They need to be not competing for resources, ideally, if at all possible, and they're garnering the public will, doing the advocacy work, supporting all of the community assets and the strengths in the community to enable the alignment of the effort. And it's a different skill set, and they have to juggle a whole range of those conversations and keep the work focused so that you get the results that you're looking for. So a few common misconceptions about the backbone. One is that it sets the agenda for the work. It doesn't. That's the work of the whole community and all the cross-sectoral group. That it drives the solution. Again, it doesn't. It's driven often by the data and by the partners in the work. It doesn't receive all the funding. That still goes to the programs and the projects and the work that's happening in the community based on what needs to be done. And, probably a controversial one, that it can be self-appointed. Often I think you have to earn that right to be in that role and doing that work. And that's certainly, I think, the most powerful position to come from, where the community chooses who's the best who's got the right skill sets to do the work. And that it isn't fundamentally different from business as usual. It absolutely is. I'm just going to skip over that. So, just in closing, the key thing about this work is trust building. We know that if the trust is low, it costs more and it takes more time. If trust is high, it takes less time. So I think as we get better at this work and we get more skilled at it, the timeframes hopefully will get shorter. And that's it. And I'm just going to finish off there. Thank you.